guess my only other alternative would be corrective laser surgery. That sounds fun. What's that? It's where we take this little laser beam and we zap your eyes till you can see better.
Corrective eye surgery has been practiced since the 1940s. Two of the most notable advancements in these surgeries were radial keratotomy, RK, and the photorefractive keratectomy, PRK.
RK uses a diamond-tipped knife to make incisions on the cornea to alter its shape. However, RK can only be used for minimal cornea corrections.
PRK uses a laser to remove corneal tissue to reshape the cornea. The major disadvantage of PRK is the discomfort or sometimes pain. This side effect is because of the removal of some of the nerve fibers in the cornea.
Another disadvantage of PRK is the recovery time. It can take up to 6 months for vision to stabilize. Until this point, vision may be blurry until the cornea heals.
Laser in situ keratomileusis, or LASIK, is the most common and most modern of the vision correction surgeries. Like PRK, LASIK uses a laser to correct corneal defects by removing some of the corneal tissue to reshape it. LASIK has the same benefits as PRK, but the side effects are much less severe.
In the beginning of laser eye surgery, broad beam lasers were used. They acted similar to shower heads in that they split the main laser into smaller beams. Now lasers use what is called the flying spot laser to correct the cornea. The advantage of this type of laser are smoother corneal shape, increased efficiency, and increased accuracy from the surgery.
The deficiencies of the eye are largely due to refraction. This issue is rooted in the differences of the indexes of refraction between air and the cornea. The cornea and lens focus the light at the retina to show a clear image.
A normal eye is able to converge the light appropriately for objects both near and far.
Nearsightedness is a result of an overly curved cornea. When the light converges, it does so in front of the retina. To correct this, the laser is used to remove tissue from the center of the cornea to flatten it, which lengthens the focal point until it is aligned with the retina.
Farsightedness occurs when the cornea is not curved enough. When the light converges, it does so behind the retina. To correct this, the laser is used to remove corneal tissue around the edges, causing it to become more curved. This is done until the focal point is shortened to align with the retina.
Laser eye surgery is one of the fastest methods to visual correction. It also has the benefit of being able to correct a wide variety of visual impairments with minimal recovery time. Most patients of laser eye surgery are able to go back to work within a week. Laser eye surgery is also permanent, but since the eye shape changes with age, retreatment may be necessary later in life. The surgery.
A corneal topographer makes a map of the patient's cornea to figure out what must be corrected. Next, numbing drops are placed in the eyes. A device is used to hold the eyes open for the duration of the surgery.
The cornea is cleaned and suction is created around it. At this point, the doctor will use a blade to cut a flap into the cornea. This flap is folded back and a laser will be used to remove the necessary amounts of corneal tissue. The laser is computer programmed to remove a tissue amount specifically set before the surgery.
After the surgery, a shield is placed over the cornea to prevent movement of the flap, which will naturally heal.